My name is Kay O'Brien and I am a registered nurse. Well, we last met in May and now the campaign continues for a better aged care in Muswellbrook and a new hospital. As yet, we've received no formal response from the New South Wales Minister for Health to the resolution passed at the May public meeting. I would now like to introduce Granville Taylor.
Tonight I'll give you an introduction to the programme. I'll then try and outline to you the full extent of the problems that we've seen at Muswellbrook Hospital, as seen by Hunter New England Health. I'll give you an outline via Tony Neat of the current Hunter New England Health proposal, which is a 15-year plan to 2018. We'll then look at a new hospital proposal, again, which Hunter New England Health have outlined, and we'll give our ideas on that too. I'll give some reasons again under the economic justification for this proposal. Muswellbrook really is an economic powerhouse, and I think you'll see that we deserve it. We'll then summarise where we are, and then look at the next steps that we as a committee and as the people of Muswellbrook need to take. The reason for the formation of that committee was to formalise a process to move further in terms of achieving more for hospital and aged care in Muswellbrook. Specifically, our objectives are to seek that the New South Wales Government appoint a task force to fund and construct a new hospital for Muswellbrook within 5 years. If necessary, and this is our second step, we'll take all steps required to acquire sufficient signatures to petition the New South Wales Government to debate a proposal for a new Muswellbrook Hospital. So we really have two main objectives, two main concerns: to appoint a task force. We'd like to think that the government will listen to us and act on that. But if they're not quick enough to do that, or if they're unwilling, then we'll make sure that we acquire the necessary 10,000 signatures to go forward. The problems at Muswellbrook are more than skin deep. The existing configuration is just so unsuitable, it can't accommodate modern circuit breakers. Heaven help us if there's a big outage. In terms of infrastructure, that's not the only problem. In terms of air conditioning, water supply, even the nurse call system, which broke down the other day, they all need replacement. And to try and repair and rebuild the existing hospital, which has been degraded by neglect and inability to carry out these jobs, is just really a waste of good money.
Tony has a very personal interest in this campaign due to his lovely wife Madge being a resident of the current aged care facility. Tony will speak to you about what New Hunter New England Health are proposing to do about the problems at Muswellbrook Hospital.
Rather passionately about the situation concerning the aged residents. There is this 15-year plan for a $64 million refurbishment. Now, let's face it, a lot of us may not be very active in 15. The town has been deprived of X number of beds in the hospital. The town has been deprived of nursing home for about 2 years. And if we move into the Mount Providence in any way at all, if it does succeed, it's going to also create a shortage there of accommodation. The sad thing is that this town still has the licences, 18 bed licences from the Commonwealth Government, which are not being used. And I'm quite sure the Commonwealth Government will not allow us to keep those beds. And we still have down the track, we still have to wait for up to 2 years or maybe longer before there can be any movement away from the hospital. I think you need to be aware of the fact that we are being shortchanged, this town, in so many areas.
I'd like to introduce Jenny Hinchin. Jenny has been a resident of Muswellbrook for over 40 years and started her working life at Muswellbrook Hospital about an alternative plan to fix problems at Muswellbrook Hospital.
Many of you would understand from a first-hand basis that the aged care residents, the medical, surgical, palliative care and maternity patients of our community deserve better. And in saying this, we also acknowledge that our medical and nursing staff need our support to improve the facilities. Our hospital is a community resource, and now is the time for the community to help. Let's look at the other proposal, the building of a new hospital within 5 years. The costing for a new hospital on an alternative site at approximately $79 million, excluding $8.8 million that would be needed for a new aged care facility. Unused bed licences could once again be utilised by local people who deserve to be cared for in their own community. There would be no reduction to bed capacity in the general wards. The addressing of all the maintenance, safety and sizing issues that have been previously mentioned. And there would be the elimination of a 15-year Band-Aid approach, avoiding the possibility of a financial blowout during this process, or even, heaven forbid, the non-completion of the long-term proposed plan. The case is compelling for a construction of a new hospital, considering the appalling state of our existing facilities, the planned disruption and inconvenience caused to our aged care residents, patients and staff, and especially considering the economic importance of our shire to the state. The New South Wales Government allocated $4.7 billion for rural and regional hospital rebuilds.
And now back to Granville, who is going to discuss the economic justification for the new hospital proposal.
As Jenny said, the major difference in terms of the proposal to do a long-term refurbishment, 15 years, and a new hospital rebuild is an assumption that the capital is just not available. What I want to try and show you now, and will also then show to the New South Wales Government, is that not only is the capital available, but this shire produces it. Muswellbrook Shire provides, for a start, 40% of New South Wales electricity. We have a look at coal exports from Newcastle. 95% of the exports through that port represent coal. Muswellbrook Shire supplied 1/3 of this coal. That means that we're also helping keep the Australian dollar at a reasonably healthy level, not as high as it was, but it's going to stay there for a while. Well, I think I've shown you on those figures that not only do we provide the funds, some of them in fact, and we're not asking for all of them, some of them should be made available back to us to fund it. In fact, only 5% of Muswellbrook coal royalties for 5 years would supply all the funds required for new hospital construction. So no one in this room should feel greedy that we're asking for a big handout from the government. We're not. Sure, 80 million is a big bite. Not only do we deserve it, but we're earning it. We consider that the funding that is required for this 80 million doesn't need to come from us, but we'll have to show the government that it can come from, obviously, some of it from the New South Wales Health budget, some from Hunter Region funds, some from the new resources for regions, and there's every reason why we as a shire should receive some share of the sale of the Port of Newcastle. We haven't put our hand up yet, but from now on, believe me, we'll be asking for it. We as a committee are now fully aware of that, and I think that basically I want everyone to go away tonight thinking the same way. There is absolutely no question that for the people of Muswellbrook, for the Shire, a new hospital construction on a new site is by far the best solution. The 80 million or so that it needs to build it is easily justified. It's not a break-even situation, it's not marginal, it's very easily justified. First of all, I'd like to put before the meeting a simple motion. And the motion is that the Committee of Muswellbrook Aged Care and Hospital in a New Environment be empowered to make a detailed submission to the Deputy Premier to seek that the New South Wales Government appoint a task force to fund and construct a new hospital for Muswellbrook within 5 years. I'd like to put that to the meeting. Are all those in favour? Please say aye. Aye. Those against? I think that's carried unanimously. Thank you for that. This is our plan. We have suggested that the best way forward is that we'll put a task force recommendation to the Deputy Premier. If we have to go further, our next step will be to seek the support of the people of New South Wales, the ones that we keep the lights on for, to sign a petition in large numbers. We need to basically ensure that 10,000 people sign it so that our proposal is debated in the New South Wales Parliament. We can't do this by Facebook, we can't do this online electronically. If you want the floor of the House to debate such a proposal, you have to have at least 10,000 physical signatures on a piece of paper. If we have to do this, it'll result only from the patience and hard work of this committee. We need the people of Muswellbrook to get behind this.